my name is Brittany MacLeod and I am interested in partaking in the 2020 Interprofessional and Intercultural Placement in Vietnam because I've always been interested in practicing physiotherapy overseas. In high school, I completed my International Baccalaureate diploma with the hope of undertaking my physiotherapy studies in London. Whilst this didn't happen, and I am glad of my decision to stay in Brisbane and study at UQ, I believe this placement in Vietnam would provide me with the unique opportunities I was looking for. On top of this, my interest in paediatric physiotherapy has increased significantly over the past 18 months due to various experiences with caring for children. I am currently responsible for looking after two boys aged 5 and 6, one of whom has cerebral palsy. I've been involved in taking him to his physiotherapy, occupational therapy and speech pathology appointments and have seen firsthand the difficulties in coordinating this care. However, I also have a much greater understanding of the necessity for all disciplines' involvement and how interprofessional practice could create greater ease for this family, along with better outcomes for the patient. Whilst I understand the reasons against it in this case, I would love to be involved in working in an interprofessional team to further my understanding of the different disciplines. Finally, the paediatric subsetting is an area I am largely considering as a potential career path, and believe that this opportunity would provide me with a better insight into a prospective career as a paediatric physiotherapist. To me, interprofessional education is the collaboration between multiple professions in order to further their understanding of the different professions, with the aim to improve practices and thus improve quality of care for patients. In this instant, a placement opportunity involving interprofessional education in our final year at university provides a wealth of knowledge for prospective careers. I definitely acknowledge my lack of exposure to occupational therapy practice this far, and also my limited knowledge on the scope of speech pathology. Whilst the healthcare system as a whole in Vietnam may differ widely to Australia, the basic principle of providing the best services for the best outcome remains. As I've begun to understand through my babysitting job, an understanding of all healthcare professional roles is a necessity for not only successfully treating a patient, but also for developing rapport and understanding the full circumstance behind their condition. Communicating with other health professionals and learning how they approach different situations can be used in individual treatment sessions to further the patient's progression. Not only is interprofessional education key, the teamwork skills that will come out of this placement opportunity will be treasured for the rest of your career. Teamwork is a necessary skill regardless of your profession, culture, or background. The ability to work in a team, whether it is with other physiotherapists, other allied health professionals, lawyers, case managers, office staff, or even management companies, is a huge part in ensuring clients receive the best service possible with as little inconvenience as possible. I have been exposed to some of these challenges through my current admin role at a physiotherapy practice and believe that the IPIC placement in Vietnam will expose me to valuable collaborative skills alongside further developing my communication, time management, and clinical reasoning that can all be applied no matter the specific healthcare setting. I spent 3.5 years from the ages of 7 to 10 living in Malaysia and attended an international school, so have had a large exposure to the variety in culture, not just within Asia but across the world. I was lucky enough to not only travel within Malaysia to more rural settings with my school, but also travel to many countries in Asia with my family during this time, including Thailand, Cambodia, Indonesia, and Hong Kong. Since then, I've also been lucky enough to visit Vietnam and Japan. I believe that my very fortunate worldly experience has allowed me to be receptive to and understanding of the variety of culture already in Brisbane. However, I do believe that experiencing this culture from the viewpoint of a health professional will provide me with more valuable insight. I know that I will develop a greater appreciation to the access to high-level technology, research, and evidence, which I believe I will be able to use to strengthen my knowledge as a physiotherapist. Lack of access to certain things will hopefully advance my problem-solving skills and allow me to think clinically whilst thinking outside the box. Finally, I hope that I learn more about communicating clinically when there is a language barrier, as I believe that this is still very applicable here in Australia, and it is something that I'm concerned about when it comes to practicing as a physiotherapist. I believe that the challenges and experiences that come with being in another country are highly valuable in terms of contributing to me becoming a well-rounded person, which, in my opinion, is imperative to success as a physiotherapist. The main challenge, I believe, will come from balancing the stress of placement with actual clinical exposure, being in a foreign place, and having a lack of family and friend support network. I like to pride myself on being a good communicator and knowing when to ask for help. I think in this situation, being surrounded by other UQ students in the same situation will provide a wonderful replacement support network. I would also say that I'm more comfortable in a place like Vietnam due to my previous exposure to Cambodia and Vietnam, as well as having lived in Malaysia. Due to multiple overseas moves with my family, I've always liked the challenge of adapting to new places and find the opportunity to learn and immerse in new cultures exciting. I'm fortunate enough to have had the opportunity to travel overseas not only with my family, but also whilst representing my high school in both Europe and Asia. This means that I'm familiar with what it means to represent the university and school in another country. I participated in a service trip to Cambodia where I worked briefly in a school, as well as completed a community service project of building a family a house. To date, this was one of the most rewarding weeks of my life, and the Vietnam placement opportunity excites me due to its similarities. I would love the opportunity to help provide for communities that are less fortunate than the one I have been lucky to grow up in. I'm also a Gold Duke of Edinburgh Award recipient, meaning that I'm familiar with setting challenges, reaching goals, committing to tasks, maintaining balance, being persistent, pushing myself outside of my comfort zone, but most of all, enjoying everything I set my mind to doing. It would be an honour to be chosen to represent the School of Health and Rehabilitation Sciences in Vietnam and demonstrate the wonderful teaching abilities of staff through skills I've learnt at UQ. I hope that I have demonstrated to you why I should be chosen as one of the students to go to Vietnam in 2020. Thank you.